All right, so just some classic disorders really quickly. We're just going to use our curve here to describe these. And again, I'm just going to go through these kind of quick because I feel like once you have the fundamentals down like we do, it actually makes this, a little bit easier. So let's just start with aortic stenosis. So in aortic stenosis, the idea here is that to get the blood beyond the aortic valve, you need a much higher pressure because you have to get that same amount of blood in the left ventricle beyond the aortic valve, but you have less diameter to get through. And so remember, that's a higher resistance. You're going to need a higher pressure to get that same volume through a smaller diameter in relatively the same amount of time. And so to do that, you have to generate very high left ventricular pressures. So your left ventricular pressures might be somewhere up here, for example. Okay, so you have to generate very high left ventricular pressures to get that amount of blood through a valve that has stenosis. And so this is what you would classically be looking for. You'd be looking for very high left ventricular pressures. And that's kind of what I wrote here. Left ventricular pressures that far exceed your aortic pressures. Okay, what about aortic regurgitation? So in aortic regurgitation, the idea here is we're regurgitating blood back. And one of the things that we always talk about with aortic regurgitation is this increase in the pulse pressure. So why is there an increase in the pulse pressure? Well, you're ejecting a bunch of blood out, right? So here's your aorta, here's your aortic valve, let's just say. Okay, so here's my aortic valve, and then here's my left ventricle. Okay, so when I eject blood from the left ventricle, I'm going to get a good amount of this blood coming right back. Okay, and so my diastolic blood pressure is actually going to come down because I'm not really getting much blood out into the arterioles and the peripheral circulation, and my systolic blood pressure actually has to be higher because every time I contract, I'm going to get even higher and higher volumes over time from all that regurgitated blood. I think I'm contracting that blood back out to the peripheral circulation, but a lot of it is coming back. And so my pressure has to be higher to get more volume out. And so the systolic blood pressure goes up, the diastolic blood pressure goes down. If you increase systolic blood pressure and decrease diastolic blood pressure, you're increasing your pulse pressure. And so what we're going to see here on this curve is usually an overall increase in this pressure. So this blue curve might be up here, and then your aortic curve might be here. And so usually you'll see kind of this same depiction where you have your left ventricular pressure and aortic pressure. It's just that it's going to be higher up. Okay, so this is going to tend to be higher up. But the real giveaway with this is that your aortic pressure curve, this gray curve, is actually going to look something more like this. So there's going to be a much wider pulse pressure because, again, this is going to be your systolic aortic pressure, and then this is going to be your diastolic aortic pressure. Okay, so there's going to be a big drop in the pressure here. So you'll see kind of like an aortic pressure line going way down over here. That's going to be very classic for aortic regurgitation due to that high pulse pressure that we talked about. And you'll also notice usually you won't see this dicrotic notch anymore that we talked about. When you lose the dicrotic notch, that's very classic for aortic regurgitation. Remember that the whole purpose of that notch is when you close the aortic valve, you get kind of a backflow of pressure. But if you're not really closing the valve because you have regurgitation, you're not going to get that notch. Okay, so mitral stenosis has to do with very high left atrial pressures. And that's because, like we said earlier, you're not able to get all of the blood out of the left atrium. And so what would happen? Let's look at our atrial pressure curve. Your left atrial pressure, which is actually this gray curve over here, it's going to be a lot higher. So it might come out about here, okay, for example. It might look something like this. So the left atrial pressure curve is going to be shifted upwards in mitral stenosis because the pressures are going to be a lot higher. Okay, so you'll see a lot greater left atrial pressure than left ventricular pressure during diastole. When we have filling in the left atrium, our starting pressures are just going to be much higher because there's going to be more volume typically in the left atrium. In the last slide, we talked about these tall V waves, which were very much associated with tricuspid regurgitation and mitral regurgitation. And again, the V wave is the villing, right? The villing wave. And so when the V waves are high, that just means that we have increased filling back into the atrium, and that might be because we're getting regurgitated blood, right? So that would cause the V waves, this wave, to actually be very high. And one way to kind of remember it, like a shortcut, is if the V wave is way higher than the A wave, that's more of a giveaway that potentially you have some regurgitation going on or for some reason increased filling.